Compliance to TB treatment as prescribed by the doctor is a big test that patients have to endure if they are to fully recover from the killer disease. Once diagnosed with the disease, the patient is put on medication for 245 days. That means swallowing at least 4 tablets for the first 60 days, then 2 for the rest of the time spent on treatment. This prolonged prescription has remained a challenge to many TB patients, with some giving up on the treatment while others default on their medication.
TB can pass from one person to another. When he coughs, he discharges germs in the air and he will start infecting other people. But most important is that he may become resistant.
Once put on treatment shouldered by the government at a cost of 10 million shillings for the entire 8 months, every TB patient is given a treatment supporter from the community who monitors how the patient swallows the tablets by marking the date and time when the medication is taken. It is these supporters who raise the alarm to the health workers at Kiboga Hospital about any defaulter.
If patients do not complete treatment, or if they run off treatment, each sub-count has one person who is a focal person for TB in that sub-county. So we send information and they go to look for these people in their homes, okay? And they track them back.
The local authorities here then search for the defaulter, arrests them, and delivers them to the hospital for forceful completion of the drug treatment. Alex Banjana is one such defaulter. He had not taken his medication for 1.5 months after temporary relief from coughing.
Nagenda okulaba bano abebyobulamu nga bazze balina defense.
I saw the health and defense officials. They asked me if I was still taking my medication. I told them I only took my medication for 1.5 months. They arrested me and tried to tie me up with ropes, but I refused. They took me to the hospital.
Ne bankwata kifuba. Bantwalo ne bagaye kamale n'okunaaba. Ne bagandi n'ebyokunaaba totawana kunaaba tugende.
At the hospital, the doctors shared the same sentiment for the conduct of defaulting the treatment.
Omusawo ye kennyini yasituka n'ajja waka. N'angamba Alex lwakitole. Ne mugamba ssewo.
Doctor came home and asked why I was not taking my medication. He told me he was going to ask the police to arrest me if I continue defaulting.
Kati n'angamba oba ogaanye nze kennyini ngenda kufuna police.
Banjana has completed his medication and free of TB. To better understand the motivation behind these arrests, I met Leonard Kasirye, a local leader and a member of the village health team who has been arresting defaulters in Bulaji sub-county in Kyankwanzi district. Kasirye is proud of his contribution to fighting tuberculosis in his village.
Although it's not fair to harass a patient, it is proper for us to prevent them from spreading TB to other people. That's why we use some force.
He indeed attests that it has had an impact on patient compliance to treatment. Human rights activists, however, have condemned the act of arresting and forcing the TB patients on drugs as against human rights principles.
So we need to make a balance that as we protect public health rights, we also remember the constitutionally guaranteed rights of the people to least restrict them and make sure that options like counseling them, options like information provision are actually provided rather than wasting money and resources and other time in terms of arresting people.
Once the patient defaults on the first line of drugs, they are put on 60 injections and another line of drugs since the TB becomes drug resistant. The cost of treating just one person suffering from multi-drug resistant TB is 50 million shillings. Sserwanjja, NTV.